My name is Bob Ihrie. I'm the Senior Vice President of Employee Rewards and Services at Lowe's Company. We're headquartered in Mooresville, North Carolina, and represent 238,000 employees across the United States. We're involved in medical tourism and speaking at this conference specifically about our direct contract arrangement with the Cleveland Clinic and domestic medical tourism for heart surgery for Lowe's employees. As a result of our relationship with the Cleveland Clinic, we've really seen medical tourism come to be a thing that people are talking about, and specifically domestic medical tourism. So we looked at international medical tourism. We're just afraid that Lowe's employees wouldn't be willing to jump on a plane for 16 hours, and we feel that this groundbreaking program with the Cleveland Clinic has let us establish domestic medical tourism and accomplish the same objectives we would have if we had gone international, both in terms of quality and price. So the market is changing rapidly. I think we're moving to a time period when we're going to see competition on a national basis of centers of excellence, and this program is really Lowe's first step into that arena. All right, the differences between international medical tourism and domestic really relate to just how far a patient's willing to travel. So we have many employees who are in rural areas and spread out over the United States. Most of them may not have even been on a plane in their life. So for us, domestic medical tourism meant they could at least travel in the United States where they knew the language, they knew the culture, they had heard of Cleveland, and some of the things that would make them more open to considering the possibility of this enhanced benefit. Well, I think the driving force in medical tourism really is the opportunity to, at the same cost, achieve better quality outcomes. Both in the short run in terms of fewer complications and fewer readmissions and quicker return to work, and in the long run just to improve quality of life for our employees. I'm not sure that the new healthcare reform bill will have a lot of effect on medical tourism, at least in terms of the Lowe's program itself. As you know, we really had health insurance reform, not health care reform. This program really is squarely in the realm of health care, and therefore likely have little impact on it. I think all it will do is accelerate the need for employers to try to control cost, and domestic medical tourism for high-cost surgical procedures is one of the ways that Lowe's is using to address that cost curve. Michael McMillan from the Cleveland Clinic and I spoke about this groundbreaking program between Lowe's and the Cleveland Clinic, really a partnership to have offer our employees with no deductible, no out-of-pocket, covering all travel costs for the employee and a companion, the opportunity to go to Cleveland and have the highest quality surgery in the world done at the Cleveland Clinic. And our employees have taken us up on that dramatically. We've already had 16 employees take advantage of that offer of free surgery at the Cleveland Clinic in the first 5 months of the program, and that's at least double what our anticipation was for the entire year's participation in this program. So we're off to a great start. I think we've done a lot of things right, and I think we've got a tremendous future in the partnership with Cleveland Clinic and with medical tourism for those procedures that it applies to. We've mainly spoken at the conference, so I haven't even had a chance really to go to the exhibition halls and so on. We spoke both this morning and this afternoon, so I have to reserve comment on that till I have an opportunity to go meet it. But I will say that you know, we've gotten well attended. Both of our sessions were very well attended. We got you know, different types of questions from the medical tourism conference, more questions around from the provider community and that side of the house. This afternoon as we spoke, we got more questions from employer providers of self-insured employers, and sort of a different slant on the questions, and more interested in how they can operationalize the program that we have and consider it for their employees. So both of them very helpful sessions, and we think they went very well, judging by the fact that we got a lot of comments from a lot of questions from people, and a lot of people afterwards asking us for follow-up questions.